So now what? What are you going to do on October 1st? Tell them how this has got to work. President Obama, well, let me give folks just a little bit of background. About what's already in place and then what happens on October 1st. When we passed the Affordable Care Act, there were a number of components to it. A big part of it was essentially providing a patient's Bill of Rights. That Americans and advocates have been fighting for decades. So what we wanted to do was make sure if you already have health insurance that you get a fair deal. That you're being treated well by your insurers. So we prohibited insurance companies from imposing lifetime limits. Which oftentimes if a family member really got sick, they thought they were covered until suddenly they hit that limit and now they're out hundreds of thousands of dollars with no way of paying. We said to insurance companies, you've got to use at least 80% of your premium that you're receiving on actual health care, not on administrative costs and CEO bonuses. And if you don't, you've got to rebate anything that you spent back to the consumer. So there are millions of Americans who've received rebates. They may not know that they got it because of the Affordable Care Act or Obamacare, but they're pretty happy to get those rebates back. Because it made sure that the insurance companies were treating folks fairly. We said that any young person who doesn't have health insurance can stay on their parents' health insurance until they're 26 years old. And as a consequence, what we've seen is steadily the rate of uninsured for young people. Dropping over the last 3 years since the bill passed and obviously providing a lot of relief. To a lot of parents out there, because a lot of young people as they've been entering into the job market at a time when jobs are tough to get and oftentimes benefits are slim. This is providing enormous security until they get more firmly established in the labor market. We provided additional discounts for prescription drugs for seniors under the Medicare program. And so seniors have saved billions of dollars when it comes to their prescription drugs. So there have been over the last 3 years a whole array of consumer protections. And savings for consumers that result directly from the law that we passed. And for those who say that they want to repeal it, typically when you ask them about what are all these various benefits, they say, well, that one is good, and that one is pretty good, and we'd keep that. And you pretty much go down the list, and there's not too much people object to. You will recall also at the time that part of the way that we paid for the healthcare bill was we said Medicare is wasting a lot of money without making seniors healthier. And there was a lot of hue and cry about how we were taking money out of Medicare. Well, it turns out that we were right, that we could change how doctors and hospitals and providers were operating. Rewarding them for outcomes, as opposed to simply how many procedures that they did. You started seeing practices change among millions of providers across the country. Medicare rates have actually slowed in terms of inflation. Seniors have saved. Money. Folks are healthier. And some of those savings we've been able to use. To make sure that people who don't have health insurance get health insurance. Now, this brings me to October 1st. The one part of the Affordable Care Act that required several years to set up. But a critical part was how do we provide health insurance for individuals who don't get health insurance through the job? It's a historical accident that in this country health care is attached to employers. And part of the problem is if you're out there shopping for health insurance on your own. You're not part of a big pool, well, there's no aggregation of risk taking place for the insurers. So they're basically going to say, let's see, you're 50 years old. You got high blood pressure. And we just look. At the actuarial tables and we figure you're going to get sick, so we're going to charge you $1,500 a month for health insurance. Which the average person has no way of affording because there's no pooling of risk. So what we said was we need to set up a mechanism to pool people who currently don't. Have health insurance so that they have the same purchasing power. The same leverage that a big companies does when they're negotiating with the insurance company. And essentially what we've done is we've created what we're calling marketplaces in. Every state across the country where consumers are now able to be part of a big pool. Insurers have to bid, essentially compete for the business of that pool. And what we now have set up are these marketplaces that provide high-quality health care at affordable prices. giving people choices so that they can get the health insurance that they need and they want. And the premiums are significantly lower than what they were able to previously get. I'll take the example of New York State. The insurers put in their bids to participate in these marketplaces. It turns out that their rates are up to 50% lower than what was available. Previously, if you just went on the open market and you tried to get health insurance, so just by pooling and creating competition so that insurers have to go after people's business the way they go after a group plan, we have drastically reduced premiums and costs. On top of that, what we're now doing is we're saying if with the better deal that you got you still can't afford it, we're going to give you tax credits to essentially subsidize your purchase of health insurance. And here's the net result. We'll be continuing to roll out what the actual prices are going to end up being. But I can tell you right now that in many states across the country, if you're, say, a 27-year-old young woman, don't have health insurance, you get on that exchange. You're going to be able to purchase high-quality health insurance for less than the cost of your cell phone bill. And because all the insurers who participate are required to, for example, provide free preventive care, free contraceptive care, that young woman, she may make up what she's spending on premiums just on her monthly use of healthcare. So this is going to be a good deal for those who don't have health insurance. Those who already have health insurance get better health insurance. And the best part of the whole thing is, because of these changes we initiated in terms of how we're paying providers. Healthcare costs have grown, as you pointed out, Mr. President, at the slowest rate in 50 years. We are bending the cost curve and getting at the problems. That are creating our deficits in Medicare and Medicaid. W.J. Clinton, I should point out that, so far, in most states, one of the good things that at least I didn't. Know whether it would happen is when we began this in the United States, more than 80% of the American. States had only one or two companies providing health insurance who had more than 80% of the market. So there was, in effect, no price competition. So what I was terrified of was we'd open these things and there would only be one company show up and bid. And this whole thing, we'd be having an academic conversation. Instead, it's actually led to the establishment of more companies doing more bidding. And I think part of it is they have greater confidence that they can deliver healthcare at a more modest cost. So far, it's good. But I think it's important for you to tell the people why we're doing all. This outreach because this only works, for example, if young people show up. And even if they buy their cheapest plan, then they claim their tax credits. So it won't cost them much, $100 a month or so. We got to have them in the pools, because otherwise all these projected low costs cannot be held. If older people with pre-existing conditions are disproportionately represented in any given state. You've got to have everybody lined up. So explain what kind of all the work you've been doing on the outreach for the opening on October. President Obama, I think President Clinton makes a really important point. And the way pools work, any pool is essentially those of us who are healthy subsidize somebody who is sick at any given time. We do that because we anticipate, well, at some point we'll get sick and hope the healthy person is in our pool, so those costs and those risks get spread. That's what insurance is all about. And what happens is if you don't have pools that are a cross-section of society, then people who are already sick or more likely to get sick, they'll all rush out and buy insurance. People who are healthy, they say, you know what, I won't bother. And you get what's called adverse selection. Essentially what happens is that the premiums start going higher and higher because the risks aren't spread broadly enough across the population. So you want to get a good cross-section in every pool. That's why big companies have an easier time getting good rates for their employees than small companies. Because if you only have 5 employees and one person is stricken with breast cancer, let's say, your rates potentially shoot up. But if it's 1,000 employees, then it gets spread out.